Good morning, everyone. Welcome to the February 2nd, 2021 meeting of the Calvert County Board of Commissioners. At this time, I'd like to ask Commissioner Hutchins to give the invocation, please.
Thank you, Mr. President. Good morning, ladies and gentlemen. Please join us in prayer or reflection as we convene today's session. Please remember Mr. Anthony Williams, who passed away Sunday. Let us pray for his family as they go forward in life. Today, after I have a thought for your contemplation and support of our undertakings here. From the Old Testament, Hebrews, which reads in part, "Therefore do not throw away your confidence. It will have great recompense. You need endurance to do the will of God and receive what he has promised. For after just a brief moment, he who is to come shall come. Let our recompense be for this board a good place to live." Thank you and amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So at this time, is there any additions or corrections to the agenda? If not, the chair would entertain a motion to approve the agenda.
Mr. President, I move to approve and adopt the agenda as submitted.
Second, Mr. President.
Have a motion and a second to approve the agenda. Discussion. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Next item on the agenda is the public service announcement. And today we have Dr. Polsky from the Health Department. And he's going to give us all an update on the COVID vaccinations. Morning.
Morning, gentlemen. Thank you. I'm just going to wait for the slides to pop up. So I'm going to start just very briefly. I had a request to talk about COVID testing. So I just want to review that, and then I'll move to the vaccinations. So we have taken a slightly different approach in Calvert than in many other parts of the state in terms of testing. As opposed to having mass testing sites, we acted relatively early to start moving as much of the testing into people's physician offices as possible. And as a result, at this point, every primary care provider in the county, including our pediatric providers, are now capable of doing COVID testing in their offices. Also, our urgent care centers, now all three of them, so Solomon's, Prince Frederick, and Dunkirk, have both rapid and PCR testing, and that's available 7 days a week. So up on the slide, it indicates that in private physician offices, testing is available as many days as they are open. Some are open 5 days a week, some are open 6 days a week, and then the urgent care is 7 days a week. Because of the very limited leftover demand, we still have some service through the health department, very little. So last week, as an example, only 17 people showed up for testing at our health department site, and we had plenty of openings available. Just there aren't that many people who still need additional testing.
Is the results pretty quick, Doc?
Well, the rapid tests are available in 15 to 20 minutes, and then the PCRs are send-out tests, and that takes some time. Although now we have one office, primary care office in the county, who has a rapid PCR test. It took them, I would say, close to 6 months on a wait list to be able to get their machine. Otherwise, it's generally a 2 to 3 day turnaround. For the PCRs are a little bit more accurate, and particularly for people with no symptoms. So if they potentially had an exposure to somebody with COVID, or maybe they traveled somewhere and they're not symptomatic, the rapid tests are probably, and will miss anywhere from about half the infections, maybe even to 2/3. So we generally recommend, if the rapid is negative in those situations, that a PCR test be sent as a confirmation. Okay. And then because I think there's been an overemphasis on testing, and I will quickly hedge that to say that I think testing is extremely important, and the testing should be available for anyone who needs it. But then going beyond a certain point has not been shown to be helpful. So I'll still hear sometimes, for epidemiologists and others that, more testing, more testing, more testing. But we now have close to a year's worth of data taking a look. And so, as is on the slide, when you take a look at the spectrum across the 24 jurisdictions in Maryland, there is absolutely no correlation between the amount of testing done in a county and their positivity levels. And that goes on the upper end of the spectrum for the counties that are doing the most testing, and also goes for the counties that are doing the least testing. If you take a look at any of those, they're all doing sufficient testing. And that is shown because in any of those quartiles, that the distribution around the median, here's your positivity, middle positivity, these are lower levels, these are upper levels. No matter which group of 6 or 10 you take, they distribute equally around that median.
So,
And then-
Doctor,
yes.
then what correlations or assumptions can you draw from that, and looking towards the future of,
Right.
of where we are?
So I'm going to flip the next slide, and then I'll answer your question if that's okay.
Sure.
And this also holds for deaths. So when you take a look at the 10 jurisdictions that have the highest rate of testing, they pretty much split between, then you have the median in mortality or fatality rates per 1,000 or per 100,000 people. Those top 10 testing counties, 6 actually have higher than average fatality rates and 4 are below. And if you take a look at the counties that have the least testing, they also distribute around. And then I put up on the final bullet point on that slide that Calvert County has the second lowest COVID mortality rate in the state. So I just don't want anyone to think that because we are doing less testing than the average in this county per capita, but that should not be confused as leaving people vulnerable. So now addressing your question, Commissioner Hutchins, that I think it's extremely important that the primary factor in determining is human behavior. And we saw this, and I'll flip to the next slide. So the COVID cases per week, and this is not just indicative of what happened in Calvert. So the slide goes from October 1st through this past week. And what you'll see is starting right around Thanksgiving, as people started getting together for this, that, and the other, the rate started climbing. And then as people got together for office parties and other social functions leading up to Christmas, the rate kept accelerating. The rate accelerated through Christmas. New Year's, there were lots of get-togethers and parties, including for kids. We had lots of contact tracing where we found out that there were sleepover parties for teenagers and for children. And we saw a dramatic increase in the number of cases in children and young teens during that phase. And now that the holidays are over, now we're starting to see the case counts come back down. So you can test all you want, but ultimately what determines transmission is how we behave individually and how we behave as a community. And so the message that I would take from this is that the epidemiologists, it's great, you need to have them, but the most important are the behavioral economists, the people who try to explain why we do things for the reasons that we, the reasons we do. I've lost my in the middle of my phrase, but our motivations for the behaviors that we have. And so my hope is, and a lot of what we have encouraged all the way through since back last spring, was your actions should be respectful of your family members, of your neighbors, that we all do have a collective responsibility. And hopefully, as we move into the spring, we know that vaccines are now becoming available, but still, on average, right now, only 7% of the state is vaccinated, and that continued increase in the percentage of vaccinations is going to be gradual, as we all know, because of the kind of bottleneck as far as production of vaccines. So our behaviors are still extremely important, and I don't want to get too deep into the new variants of COVID unless you want me to, but that also may play a big role in these continued curves into the future of how we see things go up and down. And then on our website every week, we post for the past 4 weeks, not only the number of cases, which is the total to the far right, but we also break it down by age groups. And then you can see for the 0 to 14, there was a significant bump up, almost doubling prior to and that only goes back 4 weeks. If you go back before Thanksgiving, more than doubling as you went from early November into the holidays. And so the bulk of the cases are in that kind of mid-age range, 35 to 55.
Doctor, on COVID cases are drawn from what? Or are they drawn from testing? Or are they drawn from intake in the emergency room?
So every time someone is tested for COVID, whether they have a positive or negative result, the results go into a state database, and then those results are available to the person's home county. So if a person works in Calvert, but they live in St. Mary's, we don't get that data, it goes to St. Mary's. And conversely, if somebody lives here, but they work in Anne Arundel, we get the data. So we can extract certain things, like age, we can extract that. Other things, there's only so much detail within those reports. So then the contact tracing takes place, which is every time we get a report, we make an attempt to contact the person, find out, are they in a high-risk situation? Do they work in a nursing home? You know, what's the issue there? Daycares are a constant source of frustration. And then making sure that we try to contact the people immediately around them so that they can take precautions, they can quarantine as necessary, they can get tested as necessary. But yeah, the data is certainly limited to the reports that we get from the state.
Very good. And if we can talk some more offline, because I see this as directly correlated to the number of testings that we're doing in order to arrive at that distribution and case level. But we can talk
Okay.
some more offline. Today's just, an update for the public.
So Doc, on that, and boy, and I'm really not trying to open up a big door here, but
Yeah.
so obviously it seems like distance, right? And that's just common sense, right? If you're not around anybody, you don't catch anything, right? A cold or what have you.
Right.
It looks like we're probably 2 years before we're vaccinated, unless something completely changes. I mean, at this rate.
I think it'll be a shorter time frame than that, but that is dependent on Johnson
Supply.
Johnson and AstraZeneca vaccines will probably get FDA reviews this month. The Novavax vaccine may get a review within the next month. So it's possible the supply could expand significantly over the next 4 to 6 weeks, but we don't know at this point.
And I heard you mention daycares is where I'm leading here is.
Yeah.
So if you're mom and dad and you're the school system, how do you address this? I mean, we've seen what the governor has said, but I know sometimes those bullet points get perceived, however sometimes, but like we said earlier, till you actually read an order and get down through it. I mean, as the health officer, I mean, how do you handle that?
Well, we have relationships with every daycare in this county. And we have contact tracers that are actually specifically dedicated to daycares and schools so that we can coordinate, because we realize that for younger age school children, there is an overlap between what happens in daycares and what happens in schools. So we don't treat them as fragmented silos. We bring that
Very
together.
similar.
Correct. And I realize I don't want to get into school openings and school closures, but we have a very, very close relationship with the schools as well, because despite the schools not being open to the general student population, there's still the internet cafe children and special needs students. And so we have a very clear and well-functioning reporting system for any students, any faculty in the school, to make sure that we can try to catch anything as quickly as possible. Right. So as far as vaccinations, these are the totals for what we've received up to this point. We were receiving nothing but Moderna vaccines until this past week, and then we got one shipment of Pfizer vaccines. They come in lots of 975 vials. The Pfizers have to be handled in a much different way, so that's the vaccine that has to be stored at -70 Celsius, and it has to be reconstituted in a way that Moderna doesn't, and the number of cc's are different between the Moderna and the Pfizer. So the reason you see lower utilization of the Pfizer is that we were concerned that if we just intermingled at the same clinic, that we could end up with safety issues. And ultimately, to me, the same safety and healthcare standards apply at our health department as applied when I was in private practice. That, just like I wanted to make sure that every one of my patients was taken care of properly, we have the same responsibility to every citizen who comes in to get any kind of health care through the health department, including vaccinations. So we were told that the Pfizer vaccines were going to be a one-time allotment, and what we decided to do was isolate the clinics that we were using Pfizer, so there was no intermingling, and we will finish up the remaining Pfizers this week. So if anybody looks at it and said you only used half, that was deliberate, and they will be used this week. The Moderna vaccines, we had a few left over, so we've administered 95% of the Moderna vaccines that we have received. So where are the vaccines taking place? Well, lots of places in the county. So as many people know, that our primary vaccination site is off Route 231. We have a drive-through, which has been functioning very smoothly, very efficiently. Typically, we're vaccinating 400 to 500 or more people at a clip over at that site. But we're not just vaccinating there. CVS and Walgreens were contracted through the federal government to vaccinate all of the nursing homes and assisted living facilities, maybe where they did not quite live up to their contract. So midstream, we picked up because we did not want to see any preventable outbreaks at any of those centers. So some of our staff and resources got diverted over to vaccinating at nursing homes and assisted living facilities. The only assisted living facilities left in the county that have not been vaccinated are two very small ones. There's just been a little bit of coordination struggles there, but they will be taken care of this week. We also, there are people identified through the county's Office on Aging that have severe mobility problems. So we have nurses who are now going out to homes to make sure that those people get vaccinated. Obviously, time intensive and staff intensive, but very high risk people. Senior centers, and I'm not sure if Jennifer Moreland will mention, but we've been partnering with the Office on Aging, Jennifer's division, and Department of Transportation to try to coordinate. Oftentimes the easiest, because again, for many seniors, they can't just hop in their car and go driving everywhere. So we have partnered with the hospital to help us do outreach and set up clinic sites at senior centers or at senior living communities so that we can vaccinate oftentimes several hundred people in a few hour period and have that done. And then dialysis centers, another very high risk group. So our nurses have been going out to the county's dialysis centers and making sure that both the staff and the people who come in for dialysis services are vaccinated. And then we also have started both with daycare and school-based. Daycare people are coming to our vaccination center. School-based we're doing at Calvert High School so that we can, again, make sure that it's a good use of resources. And we've been partnering with the school nurses throughout. They've helped us with vaccinations at our vaccination site. And because they were well trained there, then we're able to make really efficient use of our staffing to set up at Calvert High School to help with that vaccination. And then percentages of the population who are vaccinated. So this is as of, I guess when I made up the slides, were 1 or 2 days ago. So our county, 9.4%, and this is through the state's figures as we report in through the reporting system, 9.4% of our county's population. St. Mary's also is doing an extremely good job. The average across the state, as I mentioned earlier, 7% of the population has been vaccinated. So, we're doing a good job staying ahead of the curve at this point. And truly, the biggest holdup is the supply of vaccine. And we know that there are many people, thousands of people in this county who would like to be vaccinated today. And we would very much like to be able to vaccinate them. The problem is that our allocations are, and this goes for every health department across the state, not what we want it to be. Our allocation for this week that we're in got cut by 2/3, and those vaccines are going to pharmacies like CVS and Rite Aid and Giant and Safeway. At the moment, as far as I know, there's only one pharmacy in Calvert that has received any vaccines. And then the state is now diverting, I'm not sure how many, but they're diverting vaccines to mass vaccination sites, which are opening this week at Six Flags and the Baltimore Convention Center. within the next 2 weeks. The state is looking at opening more mass vaccination sites at the Raven Stadium in Baltimore, possibly in Charles County at their minor league stadium, although that's not set yet. One site over in Wycomico on the Eastern Shore, and possibly one site in Hagerstown. Those are the tentatives. The presumption is that there will not be a bigger supply from the federal government, and so it's likely that more vaccines will be diverted from the allocations to local health departments.
So, Doc, when it goes out to private industry like that, are they working off the same list that you have, or is it a
No.
first come, first serve?
It's a first. So what we've been told at this point is that anyone in categories 1A, 1B, or 1C will be equally eligible. And so I have, along with all of my colleagues, have voiced extreme concern up to state level that, and I'll use one example, that a 19-year-old working part-time at a grocery store who was 1C will now have the same ability to register for an appointment that somebody with severe heart disease and other medical conditions.
Right.
Those-
Like I'm 52 and knock on wood, decent health. There's people that need it before me.
And there are people who they don't have internet access. I mean, certainly the school situation has brought that out, not only in Calvert but all across the state. There are people who have mild to moderate dementia and are not going to be able to essentially just fight for a spot. And so, to me, this is not the ideal from a public health standpoint. This is not the best way to approach things. And again, all I can say is that it's not just me, but all of my colleagues, all the health officers across the state have.
Because these private companies aren't paying for the vaccine, correct? I mean, the only financial state in the game they could say is we're using our employees.
I'm honestly not sure what the business side of things are. My understanding is that the federal government is purchasing these vaccines. Right. Pharmacies can charge, I think, for an administration fee, meaning that they can charge a certain amount to actually, inject the vaccine in. Our health department does not do that. But otherwise, I'm not sure the vaccine itself that there would be any profit motive.
Right. Obviously, you know where I'm going, and I agree with you. I mean, it's tax dollars being spent to purchase these vaccines. The list ought to be the list. I mean, it shouldn't be circumvented to first come, first serve, because, no disrespect to anybody, but
Preaching to the choir.
Yeah. So is that making any headway? 24 jurisdictions.
Well, and you've seen how quickly and unpredictably things have changed, at upper levels throughout, since last February, March, much less with the vaccines themselves. So what decisions may come down tomorrow or next week, I can't predict any better than anyone else.
Wow.
So, Mike, every Thursday there's a statewide COVID call from the governor's office for county leaders. So last Thursday I participated because of what Dr. Polsky had been telling us and what you see. Every day the governor's on TV expanding eligibility and opening up mass centers. And there were 8 or 9 other counties on there, and we all expressed our frustration of how the state is creating all this frustration for the counties and citizens, because they hear the governor and they think they can go get a shot tomorrow.
Right.
We were told that the reason they were starting these private contractors out now was a pilot, because when dosages become more readily available, they figure they're going to need those facilities to help get the dosages out. Our argument was that we can't even get through phase 1 with the doses we have, and now they're taking our doses and distributing them, just like you said, to private vendors who are not going to follow our protocols. They're just going to take them first come, first serve. So that's going to create more issues in the community of why 19-year-old Johnny got a shot,
it, and
my
someone with
85-year-old grandmother can't get a shot. And it's just making a situation that's already complicated much worse. They said they heard us. We'll see if that translates into any action.
So right now, for every vaccine that's been made available, there are 6 people who've been deemed eligible. So 5 out of every 6 people who feel like they are now should be prioritized. There's no vaccine for them at the moment.
Because our argument was, if you get to enough dosages where you can get down to phase 3 or 4, then open it up.
Sure.
Let me walk in Giant and get one, but not today.
Right.
When we can't get enough to get through essentials that we need to get through, don't be taking our doses.
I agree.
But it's too late. That horse is out of the gate. We'll see.
Well, what we got before us is just focus on delivery of what we got. That's the main issue.
Yep.
And that we are absolutely doing our best to make sure Our expectation based on what we have set up this week is that we will have no more than, we should have 0 left at the end of this week, which has happened several other weeks. And one week where, when it was clear that CVS was not going to vaccinate one of our nursing homes and we wanted to go over there, we didn't have enough vaccines on hand. We borrowed vaccines from the hospital, who was still in the process of vaccinating their staff, until we could get more from MDH next week to pay them back. So my expectation is, the vaccines we have right now, again, we will make sure they are all administered before the week is finished, and then we'll see what next week brings. And that's the other, for people to understand, that we don't find out how many vaccines we're getting for the next week until the weekend. So it's generally, and oftentimes Saturday night, one time Sunday morning, before I knew what we were going to get on Monday. And so planning and staffing become extremely difficult. And the last thing we want to do is sign somebody up for a vaccine and then have to pull it away from them because we don't get enough doses. So we're left every week with a bit of a mad scramble the last part of the weekend and first thing Monday morning to make sure we're setting all these things up, getting staffing appropriate, getting people registered properly. So it's been a chore.
So we have a registry, so we still want to encourage people to register. I don't know what the number is up to now. The last time I saw was 25,000 we had registered. So we still encourage citizens, as frustrating as it is, please register so at least we have you on the list.
And everyone should be aware that we are absolutely doing our best to make sure that we get people prioritized and get people in as quickly as we can.
Yeah.
All right.
Well, thank you, Dr. Polsky.
Thank you.
We appreciate
Thanks,
your
Doc.
efforts.
Thank you all.
Absolutely. Have a great day.
Thanks.
So the next item on the, oops, sorry.
Continue to go.
All right, sorry.
I just wanted to elaborate on what's being done with the senior centers. This is Jennifer Moreland, Director of Community Resources, and of course our department oversees the Office on Aging, and as well as the Division of Public Transportation. So as Dr. Polsky indicated, we have been working to vaccinate our more vulnerable seniors. So he had mentioned transportation challenges, you had mentioned technology challenges, and that's a real issue and it requires a lot more hand-holding. And oftentimes we're reaching out to the family members, our staff is reaching out to the family members, or we're working one-on-one with them to get them their appointments scheduled. We've had a few drop in, but for the most part, we've been able to arrange all appointments, so that's been good. So far, we've vaccinated over 300 residents, and we just finished up our second week, and we're moving into our third week. We have one scheduled this week. The hospital, Calvert Health, has actually been providing the vaccines, so they're giving the vaccines, and their staff are at the clinic. They've actually had nurses as well as an EMT there, which has been really helpful. And our staff is assisting with the registration process and moving them in and out of the building, because these are not drive-through clinics. These are sit-down clinics. So we've really had to keep folks in their cars, and that's one thing we want to encourage, that if they're coming to a senior center clinic, they stay in their car till their appointment time, because that helps us maintain that social distancing. Interesting enough, we've been doing this now for 2 weeks, and we just got a memorandum from the Department of Aging and from the Department of Health saying they wanted counties to start partnering to age office areas on aging to start partnering with the health department. So luckily we've had that experience, and we're feeling pretty confident now going into our third week. And we'll be reporting that data to the state on a weekly basis. The hospital's been a great partner. I think we'll be moving now with the health department's vaccines. Second clinics have already been set up for those that have already been registered. So all seems to be going well, and I'm just very grateful for our staff, because they moved into that position even before the state indicated that it was their role. So that was very brave of them, and just feel very fortunate to work with them.
Thank you, Jen.
Thank you.
Sorry.
Thanks, Jen.
That's okay.
Mr. President,
Yes, sir.
I have one public service.
Sure.
Thank you, Mr. President. Public service announcement. The FBI continues their investigation of the attacks on the Capitol and the death of one of the officers there, who, by the way, will lie in state today and tonight. If you have any information on that, or anyone that you hear about, please call 1-800-CALL-FBI. That's 1-800-225-5324. Thank you.
Welcome. So, with nothing else, the next item on the agenda is awards, Employee of the Month. Lorraine?
Good morning, Commissioners.
morning.
Lorraine Joyner, Executive Administrative Assistant with the Department of Community Resources. A little out of breath because I was planning to do this virtually and we lost internet and phone at the Community Resources building about 3 minutes ago and I ran all the way up here. So
Oh, wow.
I am here and hoping my glasses don't fog up too much. Here today as Chair of the Employee Recognition Committee to introduce Calvert County Government's January 2021 Employee of the Month. The Employee of the Month Award acknowledges individual excellence for superior job performance. When selecting recipients, we look for effectiveness of public contact, respect of fellow employees, quality and/or quantity of work, contributions toward improving organizational morale, and actions that improve our public image. Anyone can nominate a coworker for this award. However, nominations must be signed by the employee's immediate supervisor and department head. Look for more information on the ERC page on the county intranet. We encourage everyone to watch for workplace excellence. Okay, I had to recuse myself from this vote, but I am delighted to have the privilege of introducing our January 2021 Employee of the Month, my coworker, Community Resources Specialist Jacqueline Calvert. Jackie was nominated for her work on 3 community development block grants. Grant writing generally requires serious attention to detail, but CDBG grants are notorious for the level of time and effort required. There's a lot to manage and a lot to be said about Jackie's work on these grants. Jennifer Moreland will share more about those efforts in a bit. What I want to share today is what it's like to have Jackie as a coworker. Community Resources Specialist is the perfect title for Jackie. Since she was hired in July of 2019, she has truly established herself as a resource expert. She has updated and created numerous guides and FAQs that provide valuable information on resources for veterans, the homeless, those in need of rental and mortgage assistance, and federal employees impacted by government shutdowns, along with listings of resources related to COVID and landlord-tenant concerns. Jackie has a deep commitment to serving our most vulnerable citizens. She's very active in efforts to address homelessness. She's a team player who is always ready to lend a hand or offer a word of encouragement. I could talk at length just about her contributions toward improving organizational morale. She is an extraordinary employee and an incredible asset to our department and to the citizens of Calvert County. She definitely deserves this award. The ERC is delighted to be part of this recognition. Personally, I am thrilled that Jackie was selected as Employee of the Month. Thank you, Jacqueline, for all you do. And as always, thank you, Commissioners, for your continued support of the Employee Recognition Committee. And I'm going to turn it over to Jennifer now because I know that there's things she wants to share and I need to catch my breath.
Thank you, Commissioners. As Lorraine mentioned, Jacqueline is a gem in our department. She has got such determination, charisma, and the smarts to accomplish so much. It's a pleasure to be her supervisor. But what she achieved this year was just phenomenal. In 2020, she wrote and received 3 grants from the Maryland Department of Housing and Community Development, totaling close to $1 million in COVID-19 relief. These funds supported a senior traveling nurse, homeless case manager, quarantined vulnerable populations, and provided rental assistance for families experiencing financial hardship due to the pandemic, which we're still providing throughout this year, all of those services and into the future. So that's very exciting. Jacqueline also administered an $800,000 community development block grant to support the construction of End Hunger's 21,000 square foot food storage and distribution center, which is now, if you drive on Route 4, you'll see that in development. So happy we're in the construction phase, and we'll be giving you a report out on that soon. As you know, these federal grants are notorious for the amount of documentation and data and monitoring required. But Jacqueline, she is uniquely suited to grant management because she's got such attention to detail and process, and she can juggle multiple tasks like nobody's business. She's also able to connect dots between the needs of citizens and the programs that make a meaningful impact to address those needs. And I just, I think Lorraine alluded to this. She is a bright light in our office. She just makes being her supervisor a dream. She's got a winning attitude. She's always pitching in where help is needed. So I just want to thank you for giving us this opportunity to thank her. Jackie, you deserve this. Congratulations.
Thank you, Jennifer. So Jacqueline, are you online?
I am. Thank you so much, everyone. Commissioners and colleagues, thank you so much for taking the time to share your appreciation. Knowing that you value this hard work makes me so happy to be working in Calvert County. I consider myself lucky to be working with such wonderful coworkers, such as Lorraine, who just ran to the boardroom to present. And I've had passionate mentors along my career who are able to help me find what I love. I really love citizen and constituent services, and this position really helps me merge my love for helping those in need and working within state and federal agencies. It's really rare to have a job that's so fulfilling and has a direct impact on the community, but I'm confident many of us here today can relate to that, right? I'm genuinely thankful to bring these services to Calvert and work with wonderful community partners every single day. For everyone, COVID has had quite the impact, but it's been incredible to rise up to the challenge of responding to a variety of citizen needs faced during the pandemic. I know everyone here at Calvert County government works so hard, so it really is a true honor and privilege to receive this award. Thank you.
Well, Jacqueline, on behalf of the board and the citizens of Calvert County, I want to thank you for your dedicated service to make this a better place to live. So thank you for what you do.
Thank you.
You have a great day.
You too. Thank you.
All right. So the next item I have on the agenda is the Employee of the Year. Lisa Tolome, are you with us?
I am with you. Good morning, Commissioners.
Good morning.
This is very exciting for me. So, good morning, ladies and gentlemen, as well. My name is Lisa Tolome, and I'm part of the procurement team, and I'm here today as Vice Chair and Awards Coordinator of the Employee Recognition Committee. It is my absolute privilege to announce and introduce Calvert County Government's 2020 Employee of the Year, Stanley Harris. We just want to take a brief moment to describe the process of choosing an Employee of the Year. As you see, the Employees of the Month, we have 12 of them from last year, and that's the pool in which we choose from. And then we ask for feedback from our coworkers, and Stanley received the most comments, and they were outstanding. Stanley, you are well respected and appreciated more than you might realize. I just want to share with you a couple of the comments that we did receive. If you would just indulge me for a minute. I vote for Stanley Harris. I cannot tell you the amount of work he has done for this department as well as mine. Employees like Stanley are few and far between. Stanley has stepped up and taken many roles and responsibilities within Calvert Emergency. Stanley was instrumental in assisting the Emergency Management Office when COVID hit. Stanley volunteered his time to serve as logistics chief to ensure that personal protective equipment was found and ordered for our first responders. He took the helm as EOC commander, guiding us the entire operation. Stanley has always been supportive and assisting in training his staff. Stanley has helped with numerous projects this year, including testing a new radio, getting our phone systems updated, and completing the new backup center, all during a pandemic. Stanley has handled the pandemic with our safety in mind, taking precautions necessary to keep our center clean 24/7. He answers phones in the middle of the night and always checks on us when we have large incidences to make sure that we are okay. He works with new ideas to improve morale in this high-stress industry, covering additional positions during the pandemic, always courteous. Calvert County is fortunate. Stanley Harris continues to go above and beyond. While dealing with COVID responsibility, Stanley completes all tasks and is willing to help out wherever and whenever he is needed. I feel he most represents the best of our county government in this trying year. He worked on 2 major projects, upgrades during COVID. While the county was teleworking, he came in every day. He worked with vendors to get the systems up in place. He sets a good example for his subordinates. He sees all sides of a presumed problem and talks through the outcome. He is putting a tremendous amount of work into recruiting for the dispatch center, even working with CMR for Facebook posts and videos. He will go out of his way to help anyone, regardless of what department, citizen, or vendors. Stanley Harris, one word, magnanimous. He is magnanimous, generous, tolerant, and straightforward, through which he opens the way to help, lead, and instruct others.
Excuse me,
So those were
Lisa. Did
some of
you
the
steal
few
that from
comments
Steve?
we received.
That is Steve
Did you steal that from Steve, Lisa? I need to know. I think she did.
Maybe he was the one that wrote it in.
It could have happened.
The ERC is delighted to be a part of this recognition, and we thank this exceptional coworker, Stanley, for being a strong leader, a role model, coaching and empowering his employees. He expresses interest in team members and their personal well-being. Stanley has a clear vision and strategy for his teams. He is approachable and projecting what we all know, that Calvert County is the greatest place to live and work. Thank you, Stanley, for all you do. And thank you, Commissioners, for your continued support.
Commissioner Stanley Harris, Assistant Chief of Emergency Communications. I'm truly honored to be here today to accept this prestigious award. I'm really humbled, that my hard work throughout the year didn't go unnoticed by my coworkers. And I wanted to thank the ERC for the continued work that they do recognizing, county employees. And thank you to my coworkers, my supervisors for empowering me and allowing me to be the type of employee that I am. Commissioners, 2020 was a trying year for most people personally, but it was also a trying year for Calvert County government. But through it all, we were able to recognize 12 awesome employees that really exemplified what it means to be a Calvert County employee. And although those 11 others aren't up here with me today, their accomplishments are worthy of this recognition as well. In public safety, our mission is to proactively ensure the safety of all Calvert County residents and citizens, and that's what I put front every day and what guides me throughout the day, and I truly believe that's part of the reason why I'm up here today in front of you. So again, thank you, Commissioners, thank you to the ERC, my coworkers, my supervisors for this recognition.
Well done.
Thank you.
Thank you.
And
Thank you, Stanley.
I'll bet Jackie Vaughn's got something to say.
I do, Commissioners. Jackie Vaughn, Director of Public Safety. Stanley is an excellent employee. We're happy to have him as part of our public safety team. They always say that if you're busy, give somebody a busy person another task to do, and they'll do it. And Stanley's like that. I mean, he's been very deeply involved with the radio project, and I said right from the beginning when we kicked off this project that I wasn't going to be the only one that knew about the radio project. There had to be other individuals in the county that was aware of how we were doing it, how it was being constructed, and Stanley's been very involved in that. And he's to the point that it's an everyday thing for him right now, trying to work out some of the issues with our logging recorders and all that he's very familiar with. And any task we give him, he'll do it. He doesn't complain about it. He'll come to me with thoughts and suggestions for how to do things better or how to try to make things better for the employees. And we're very happy to have him as part of our team. And he came to me about a year or so ago, Stanley, I think it was, and said, "I want your job in the future. Can you help me?" And he did, and I'm very happy that he did that. It's nice to see employees that want to excel, they want to learn, and they want to learn the ins and outs of other jobs so they can improve. And I encourage that, and I'm happy that he did that. And I've worked with him, and he's taken some classes, and and I've given him suggestions, and I'm going to continue to encourage him to improve and attend the leadership courses that he can go through. And we're happy to have him on board.
You know, Jackie, I have that talk with Mark all the time. I'm like, who in the organization, you know, do you see like that? Because we have that all, you know, we're here now, but we're talking about tomorrow, right? We're always talking, you know, Calvert County government will be here till the end of time, you know. So you know, you're like, who's next? Who's next? Who's next? And I always said, you know, you want, and there's a way to go about things, right? And if you put the work in, you know, you want to know, hey, yes, I do want to succeed. I do want to grow in the company and go higher. But how do I go about it? So, Stanley, I'm awesome to hear that coming out of Jackie's mouth, because Jackie will tell you the respect I have for her is off the chain. You know, I have nothing but respect for Jackie, and for hearing her say that to me means a lot. You know, and I'm glad to hear that we have people that you know, want to do more. You know, want to reach further. So that's great to hear. Thank you.
So, Stanley, once again, on behalf of the board and the citizens of Calvert County, thank you for what you do for Calvert County government, especially running the 911 center. When people pick up that phone, you know, the call taker is the vital link that gets them the services that they need. So it's such a vital, and the role that you set, being such a hard worker for other employees, you know, gives them guidance. That's so important to government. So we appreciate that. And
Thank
so
you,
I think we have a little presentation for you. If you come up, we'll take a picture.
Stanley, I just want to know, are you actually running for office? Because it sounded like it.
It was pretty polished. I need to work. Probably should put all those good-looking guys on the same side over here.
All right. So the next item I have on the agenda is an appointment. Deputy Director Vasallo.
Morning, Commissioners. Linda Vasallo. You have an appointment recommendation from the Fire and Rescue Commission to reappoint Tom Breen. And staff is requesting that you do that.
Mr. President,
Yes,
I'd
sir.
like to make a motion to reappoint Thomas G. Breen to the Fire and Rescue Commission as the District 3 representative.
Second.
So I have a motion and a second to reappoint Thomas G. Breen to the Fire Rescue Commission. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. So the next item is old business, item 1, Prince Rate Volunteer Fire Department. And I'm going to have to recuse myself, being a member of Prince Rate Volunteer Fire Department. So, Mr. Vice President, it's all yours.
All right. Thank you, Mr. President. I believe Commissioner Hart, would you like to read the memo, or I can read it if you prefer?
Sure. I think we're both happy to see us get to the light at the end of the tunnel here, and I want to recognize Mr. Pat Hassler back there. He's been very, very integral in getting us to this point. So, background: the construction of Prince Redick Volunteer Firehouse contract was awarded on July 16, 2009. Contract was awarded for $9,558,682. Project has incurred change orders that were a part of the original contract marked as contingency items, only if the cost is needed. To date, the county has incurred $760,798 in contingency cost. Currently, the total contract amount is $10,319,480. On March 8, 2017, the BOCC agreed to fund the Prince Redick Firehouse construction with a financial limit of $11,054,000, which included all architectural and engineering costs. On this date, the BOCC also entered into a facility ownership agreement for the construction of the new facility for the Prince Redick Volunteer Fire Department to use and to provide fire, rescue, EMS services to the residents and visitors of Calvert County. Discussion. The project is nearing completion. However, given the issues with the existing site conditions, the project has the potential to further exceed current contract price. The project's construction account has a remaining balance of $19,000. A meeting was held with the Prince Frederick Volunteer Fire Department and the Department of Public Works Capital Project Division to discuss cost overruns. It was agreed that any further financial costs would be shared between the county and the Prince Frederick Fire Department. They have agreed to cover 1/3 of the county's paying, and the county paying the remaining 2/3. Since the project is near completion, there is a concern of incurring further costs during the closeout of the project. DPW's Director Kerry Dahl and DPW's Capital Projects Director JR would like to pre-fund the project with $135,000 to cover any further potential cost. Any funds remaining in the project after completion would be returned proportionally to the Commissioner's contingency account and reimbursed by the county by the Prince Frederick Volunteer Fire Department. Fiscal impact. Fiscal impact would be a reduction of the Commissioner's contingency account by $135,000. DPW Capital Projects requests BOC approval of the project adjustment number 060 CIP for $135,000. Staff also recommends BOCC approve the addendum to the Prince Frederick Volunteer Fire Department Facility Ownership Agreement and authorize the Board President to sign the agreement. Mr. Vice President, I'd like to make a recommendation that we approve the budget adjustment number 060 CIP for $135,000 and authorize the Board President to sign, or actually have you sign the agreement.
Second.
We have a motion on the floor. We have a second by Commissioner McConkey. Any discussion?
I do. Just for anybody out there, these projects, when you hear these numbers, you set these numbers and they're estimates. They're good estimates, but all you have to do is look around and see what materials cost and things. I mean, so much changes, and I tell you the work that Prince Frederick Fire Department has done to lower these costs really can't be undervalued. I'm telling you, they have worked their tail off to try to make this as easy, as cost effective. They've relocated. I mean, really, the work they have put into this is really incredible, and I want to thank them, Mr. Hassler, and tell all the boys and men and women there that I said thank you. I'm sure the board feels that way. I mean, just can you imagine picking up your whole organization, moving it to a temp place, and then having to run the type of calls that they get out of there? So a lot of work on their part, and obviously be glad when we're done.
Yeah, it's looking good. I'd drive by it every day, so it's exciting, and you can't put a price on public safety. So you want them to have the best of the best. When you build something like that, you don't want to do it halfway and then have to spend more money in the long run. So I'm 100% supportive of it.
Thank you. All those in favor, say aye.
Aye.
Opposed? 4-0 vote.
Thank you, Mr. Vice President.
Yes, sir. Mr. President.
So the next item on the agenda is new business item 1. Commissioner Weems.
Yes, sir, Mr. President. New business item number 1 comes to us from Shannon Nizal, Director, and Molly Gallant, Recreation Division Chief. The subject, internship affiliation agreement with Texas State University. Background, Calvert County Parks and Recreation, CCPR, offers internship opportunities in several areas of the department.
Yeah.
CCPR has previously offered internship opportunities within the Recreation Division under Therapeutic Recreation. The Certified Therapeutic Recreation Specialist, CTRS, internship standards established by the National Council for Therapeutic Recreation Certification requires 560 contact hours working under the direct supervision of a certified and experienced CTRS in the field. Joy Weir, Therapeutic Recreation Supervisor, oversees this internship opportunity and is an experienced CTRS with 20 years in the field. This is the first request for a student from Texas State University to participate in an internship with CCPR. Discussion. For students to receive internship credit, Texas State University requires the facility organization, Calvert County, to complete an affiliation agreement. The agreement allows students at Texas State to utilize Calvert County's therapeutic recreation program as a clinical experience location. The student at Texas State University has been interviewed and approved for hire as a therapeutic recreation aide starting spring 2021. This employment will meet the internship requirements for her CTRS certification. Fiscal impact. This position is currently funded in the Parks and Recreation operating budget. No additional fiscal impact will be incurred. Conclusion, recommendation. Staff recommends the BOCC authorize the board president to sign the attached affiliation agreement as requested. Mr. President, I'd like to make a motion to approve.
Second?
I have a motion and a second to approve the internship request from CCPR. Discussion. All those in favor say aye.
Aye.
Opposed?
Mr.
Motion-
President,
Oh,
No.
sorry.
yeah, I heard the discussion.
Oh,
I've
I'm sorry,
discussed
yes.
it with the director extensively, and so I'm aware of what the issues are.
Sorry.
So that'd be aye.
All right. Motion carries 5-0. Next item on the agenda is new business. Item 2 is Department of Public Safety. Commissioner McConkey.
Yes, subject, apparatus grant, St. Leonard Volunteer Fire and Rescue Company 7, Inc., Ambulance 79. Background, St. Leonard Volunteer Fire and Rescue Company 7 is requesting a $352,000 fire and rescue apparatus grant for the purchase of an ambulance. Discussion. In order to apply for this grant, St. Leonard Volunteer Fire and Rescue 7 adopted by resolution formal procurement procedures, procurement committee standards, and contract administration policies. Apparatus specifications received the approval of the Chiefs Council, the Fire and Rescue EMS Association, and the Fire and Rescue Commission. Finally, the company has agreed to promissory note through which the grant funding would be repaid through service over 8 years. The county will receive a security deed of trust that will complement the promissory note. Fiscal impact. The $352,000 requested is included in the FY 2021 capital budget for the purchase of the ambulance. Conclusion, recommendation. Staff recommends the Board of County Commissioners approve the St. Leonard Volunteer Fire and Rescue Company 7 apparatus grant for the replacement of Ambulance 79 and authorize the board president to sign the fire and rescue apparatus grant agreement. Mr. President, I make a motion to approve the St. Leonard Volunteer Fire and Rescue Company 7 apparatus grant for the replacement of Ambulance 79 and authorize the board president to sign the fire and rescue apparatus grant agreement.
Second?
Mr. President.
So I have a motion and a second to approve the grant for Company 7's ambulance. Any further discussion? All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Next item is new business number 3, economic development. Commissioner Hutchins.
Thank you, Mr. President. Subject, the IEDC Technical Assistance Service Agreement 2021 to 2023 Economic Development Strategic Plan, Pivot Plan. Background. Department of Economic Development has begun work on the 2021 to 23 Economic Development Strategic Pivot Plan, which will have a special focus on economic recovery, planning initiatives, in response to the impact of COVID-19 on the local community and economy. We will work directly with the International Economic Development Council, the IEDC, advisory services staff for technical assistance to include review of the county's economic development goals and initiatives, best practices and implementation strategies, and specifically economic recovery planning in response to COVID-19 public health emergency. As part of the IEDC Technical Assistance Service Agreement, the IEDC will recruit a team of experienced volunteer economic developers to meet virtually with the Department of Economic Development staff. The IEDC team will also meet with various county department representatives and stakeholders for purposes of assessing economic development and strategic planning activities and developing recommendations for the plan and the county's response to further support business and help navigate through the COVID-19 public health emergency crisis. In addition, IEDC will collect and review documents and other background information and prepare a final 2021-2023 Economic Development Strategic Pivot Plan briefing. The project is expected to be completed by May 30th, 2021. Discussion: in order to move forward with the plan outlined above, the IEDC has requested the attached Technical Assistance Service Agreement be signed by the President and by the Board of County Commissioners. Physical impact, $23,000 covered by Federal CARES Act funding. Conclusions and recommendations: recommend the Board of County Commissioners approve and authorize the Board President to sign the attached Technical Service Agreement. And I believe we have on camera here the Director of Economic Development.
Good morning, Commissioners, and thank you, Commissioner Hutchins, for reading our memo. We are coming before you today to request approval for the technical service agreement with the International Economic Development Council. We are excited to be working with that organization once again, specifically this time to assist us in updating and expanding our strategic plan for the next 2 years, with the layer and the focus on best practices and some implementations as it relates to the impacts of COVID-19 on our local economy. So the timing is very pivotal for us. I also wanted to highlight that the funding for this particular project is and has been approved to be covered from the county's CARE funding pot of money that we do have. So the funding is covered under that. So that's what we're here for today, and I will take any questions that you have.
I don't see any questions, Kelly. Thank you very much.
Thank you.
Okay, thank you.
Mr. President,
Yes, sir. Commissioner.
move to approve and authorize the Board President to sign the attached Technical Assistance Service Agreement.
Second.
So I have a motion and a second to approve and authorize the Board President to sign the Technical Assistance Services Agreement. Any further discussion? All those in favor say aye.
Aye.
All those opposed? Motion carries 5-0. So the next item on the agenda is a work session with Department of Budget and Finance, Director Hayden. Veronica.
Hi, good morning, Commissioners. Would you like me to read the memo?
Certainly.
Background. The Department of Finance and Budget and the Department of Public Works, DPW, Capital Projects Transportation Division, will present their proposed FY22 six-year capital improvement plan, or CIP, to the Board of County Commissioners. The Department of Public Works Transportation Division was merged under the new division in DPW Capital Projects. The Transportation Division continues to oversee the repair, maintenance, construction of county-owned roads, intersections, and sidewalks. Additionally, this division constructs, manages, and repairs county-owned bridges, dams, salt barns, and stormwater drainage systems. Discussion. The Department of Finance and Budget reviewed DPW's Capital Projects Transportation Division's FY22 through FY27 six-year capital requests totaling $35,933,499. Let me start again. $35,933,471. Fiscal impact. The fiscal impact to the county for the DPW Capital Projects Transportation proposed staff recommended six-year CIP budget is $35,933,471. Our conclusion recommendation: this presentation will prepare the BOCC for the FY22 staff recommended six-year CIP, and staff is seeking the BOCC's direction on those projects. Start our presentation. Again, Veronica Atkinson, Capital Projects Analyst with Finance and Budget. Today we're going to review the FY22 through FY27 six-year CIP for the Department of Transportation. Today assisting me is also Tim Hayden, Director of Finance and Budget, as well as Deputy Director J.R. Cosgrove. This is a look at our schedule, and today is our last presentation for the six-year CIP. Next slide, please. This is an overview of the presentation. Each department will present their projects with emphasis on FY22. Each department will highlight any FY22 projects that will require additional funding in future years, and if time allows, the department can give a quick high-level review of current projects. Next slide. We will be looking for the board's guidance on project priorities, specific project work sessions, directions on decreasing the FY22 staff recommended six-year CIP. This slide reflects the debt model, projecting the county's general fund debt payments as a percentage of revenue through the proposed six-year CIP. FY22 through 27 are only projections. These projects included in this period have not been approved. As a reminder, the FY22 CIP budget would be the only year approved by the board for funding. The other years are for planning purposes only. If you look along the top of the chart, there is a red line, which depicts the county's maximum debt guideline, which is 9.5% of general revenue funds. Commissioner Hutchins mentioned at the last presentation that the county is trending below that and is currently projecting FY22 at 5.9%. If the six-year CIP, FY22 through 27, projections stay the same, we could expect to hit 7.1% by FY27. However, please remember the years FY23 through 27 are planning years, and FY22 is not final, and all debt projections can change for many reasons. Two of the most common changes are changes in funding sources for the project and/or changes to the county's long-range CIP plan. Are there any questions?
Veronica, Veronica, did you see anything? You said that we're looking obviously at 22, but did you see any project that is starting that will continue? And so if we green light something for 22, is there additional 23, 24, 25 coming behind it?
There are projects that have multiple years. Actually, just off the top of my head, and because today we're doing transportation, probably is the largest department, or the department that does that the most. So
Okay,
when JR goes through his projects in a little while, he can highlight those projects that are multi-year.
Yeah, I don't want to create the perception that, it's just, well, once you just do 22, then there's, so that just want to highlight once we get into those things that the repercussions.
Correct. In FY22, if the commissioners adopt a project, that means that the project would have to keep moving along, and if it has financing or debt in the following years, pretty much kind of tied into that.
Well, and if we're going to bond it, that's 15 years too. So I just want to make sure that, and gentlemen, we're not voting on this today, right?
Nope,
It's
just a work session.
So there's no like 2 weeks from now. Hey, okay, I'm good.
Thank you. Next slide. This slide reflects how the six-year expenses for transportation contribute to the FY22 six-year CIP of $375,105,102. Later in the presentation, we will walk through each of DPW's transportation projects. This slide focuses on the FY22 CIP expenses and revenues. Again, the FY22 budget is the only year that is funded from the 6-year CIP plan once adopted. Highlighted in yellow is the transportation's request for FY22 totaling $6.1 million. The funding sources are PAYGO, debt, state funding, and excise tax. One quick, the overall FY22 debt is over the FY21 projections by $4.4 million, as well as PAYGO at $1.9 million. What we're holding the difference against is what was projected in the FY21 adopted budget for FY22. So each of the departments gave us their FY22 numbers in FY21. Again, they were projections, we understand that, but that's what we use to base this increase over. This slide right here actually depicts what I've just explained. It does get a bit confusing, but it's basically a look at the FY21-22 projections and what staff is currently proposing now for FY22. As you look at the chart, you can see that transportation is actually $949,000 less than what they had projected previously. But overall, our expenses are $6.8 million over what the projections were.
And Veronica, it's also, you know, since you're talking about this slide as a whole, it's also important to point out that the enterprise fund, you know, is self-funding. So when you look at the enterprise fund, that's 6.3, but that's a negative number. But still, you know, we need to remind everybody looking at this slide that the enterprise fund is self-sufficient. So
yes, they're self-supporting, including paying their debt. So any bonds we sell for enterprise fund, the enterprise fund profit or usage fees pays that debt back. It does not come out of the county's general fund.
thank you.
Thank you. This slide is another view of revenues for FY22, but this slide focuses exclusively on transportation's funding sources. So to the left is a list of each of the projects that transportation has projected, and out to the right you will see which projects are looking for PAYGO, debt, excise tax, grants other, and that's it. Those are their funding sources. Again, for FY22, they are $6.1 million. Next slide, please. These next two slide details each of transportation's 6-year projects. Deputy Director J.R. Cosgrove will walk us through the proposed projects, again, emphasizing projects that are in FY22 and making a note of projects that will begin in FY22 and will have future year funding requirements.
Good morning, Commissioners. J.R. Cosgrove, Deputy Director of Public Works, Capital Projects. So we'll start with the, of course, what we're looking at is FY22. The Appeal Salt Barn, we partially funded, a prior year funded that last year to look at the design because the existing structure, of course, is failing and needs repair. So over the past 12 months, we've looked at where we can relocate it. We found a location and we're moving forward with the design with the money that was funded in the prior year. This money here for the $850,000 we're looking for would be basically to fund the construction of the project to basically build the barn and build the facility out down in off of Cove Point Road.
How old is that existing one, Jared? Do you know off the top of your head?
I believe it was built back in the mid to late 90s. If I remember correctly, I want to say like 98, 99 when it was planned. The problem was it's just, you know, it's a wooden structure. Every time the roof is failing, and we got estimates to repair it, and it was almost as much as building a new barn itself. So that's why we looked at a different location since it's part of the landfill. We wanted to relocate it off of the landfill property. The next project is the Ball Road Elliptical Culvert Rehabilitation. I'm not sure if you're aware, but as soon as you come in from Route 4 on Ball Road, probably half mile, 3/4 of a mile. There's a large elliptical pipe that is 33 feet wide, 20 feet tall, and 237 feet long. And that is considered a large structure. Every 2 years, we have to do basically a bridge inspection of it. And it's trending from 2018 to the 2020 inspections that the culvert is starting to fail. It's increasing rust on the invert of the pipe. Sure. So we at DPW want to get ahead of the problem before it fails. We've gotten estimates to repair it, and unfortunately, it's close to $1 million to basically put concrete in the bottom of the structure, pave the invert, and epoxy coat the entire structure to protect it from the weather and the elements.
Mr. Cosgrove, just
Yes, sir.
out of curiosity and for the citizens, is that the St. Leonard Creek major tributary?
Yes, sir.
Yes.
Yeah.
Just so people are aware,
It's a large drainage area.
right.
It's a large pipe.
Yes.
Very large
You
pipe.
can drive a dump truck through that pipe.
A couple of them side by side.
If you didn't catch that when he mentioned the dimensions, you can drive a dump truck through this pipe.
It's 33 feet wide,
Wow,
20 feet tall.
Yeah. It's huge.
that's a big pipe.
Yes, sir.
Yes, it is.
The next project on here is the Barstow Salt Barn. That's basically to replace the salt dome that's down at highway maintenance now. Same issue, structural issues. The roof is starting to fail. We want to move forward with basically building a larger salt barn so that we have, more storage for winter weather, as we've seen the past couple of days, within the center part of our county, to match the barns we have on the north and what we're proposing on the south. Yes, sir.
Pull your mask down.
See, the next project would be Battery Lane Dry Pond. That is a stormwater management structure up around Victoria Station. Basically, the outfall's failing, so we need to repair that. Grays Road culverts. There's twin culverts underneath of Grays Road that are in rough shape. This past storm in August we had major erosion around them. We've temporarily patched it, but we need to replace the pipes to a larger structure to handle the flows that come through that area.
So that's at Cypress Swamp?
Yes, sir.
And the 100,000 in 22 is just design money, and then you're projecting
Yeah, so
construction.
so that's design money in 22, and we're looking at construction in FY 23. And then we have Little Cove Point Road on here. We're not asking for any funds in FY 22, but just to point out, we're looking at probably construction around FY 23, because you were asking about what we might be looking at in the future.
And Jared, not to make you go into a full presentation, and I have complete confidence in you guys, I do. But man, that seems like a monster. I mean, there's no doubt how dangerous that turn is. It's one of the most dangerous turns in Calvert County, but boy,
So, we've looked at, we're through the design process. I would say we're probably at about a 30% design. We're basically shifting the road to straighten it out, more or less.
and I just can't see it. I guess I have to go, you know what I mean? It's just, God, it just seems like it's a mountain to move.
So when you head down this area past, I think it's Foxwood subdivision just before Park Chesapeake, off to your left, there's a large hill and wooded area. We're basically looking at shifting the road probably 75 feet in that direction.
Aha.
And cutting that hill out, and that'll basically straighten that.
So going that way.
Correct.
Okay. Because I was thinking the other way, and I'm going, I just couldn't see it, Okay. It's no doubt how dangerous it is. It is.
There's been a number of accidents there.
Yeah, and there's thousands of cars in and out of it on a regular basis.
Yes, sir.
It's.
So we'll flip to slide 11.
Yeah, I know when it snows, that's the part they all are scared to death of. Is that point right there?
I'm sure. So this slide, the first couple projects are some pushed out to FY 23. And then when we get down to Stoneleigh Dam repairs, the first one for 22, that's just looking for some additional funds to basically repair the outfall structure from that pond that goes underneath the public road, because it shows signs of failing also. Wetlands Mitigation Bank, we currently have the one at Cage Farm that we still have to maintain slightly, so we always put a little additional funds just to maintain that, because we don't have all the credits from the Corps or the state yet for those wetlands. And the additional funds would be looking at starting another probably 5-acre bank so that we can bank additional wetlands for any future loop road projects where we need to mitigate wetlands disturbance. Let's see, we get down to now, these are non-specific projects. These are more of a maintenance accounts are reoccurring every year. So these funds are projected all the way out through the 7-year or the 6-year CIP. First one is bridge and dam maintenance. We use these for minor repairs to bridges that show up from what we need to do from our inspections every 2 years. Roadway safety improvements, that's pretty self-explanatory, signage, some guardrails. The biggest thing to note on here would be the storm drain project account. Of course, we're asking for 1.2 million for this year, an increase from last year. We've been doing an asset management throughout the county for all our culverts based on our MS4 permit, where we need to know that the integrity of them and the outfalls. And the reason we increased it is we're looking at what we know. We've done a lot of inspections and management from the south, from Prince Frederick South, and we currently have on record 37 pipes that are what we're considering priority 1 that needs replacement within the next 12 months. Because they're failing, there's joint separations, the bottom's rusting out of them. We've gone and got prices just to line those and repair them. And just for the liners alone, or replacement, depending on where they are, we're looking at about $750,000 just for those 37 pipes.
That year when they fail, say you don't catch it and it fails.
So, in instance, if you remember a couple years ago about Pine Boulevard down in White Sands, if we didn't catch that in time, the road would collapse, similar to as it did during storm events at Hoyle Lane or Sunderly Drive this past August. So, I mean, you're looking at, we probably spent, on between Hoyle Lane and Sunderly, we probably spent almost $2 million into replacing those pipes once they failed. And we're looking at being able to fix 37 pipes with liners for less than $1 million. So we need to get ahead of this and repair our infrastructure before it fails. Because not only does it cost more to repair it, once it fails, we also possibly have citizens that can't access their home or leave their homes.
Well, you see it around the state. What was it? Was it BW Parkway was so bad? Remember the cars that were getting all tore up going through it? I mean, that's the problem with infrastructure. It's the first to get cut because roads don't vote.
Right.
I mean, that's just the God's honest truth of it. I mean, the roads don't vote, so it's the first to get cut. There's certain things you'll just never touch, right? The taboo things you don't touch, but roads are always wide open. And, you remember Rye used to say, you need a road to get to everywhere.
Yes, you do.
To run your call. I mean, it's, I'm glad you guys, that's one thing with technology, that just saving us so much money with catching some of this stuff. In the old days, you just didn't know till it blew up, basically.
I mean, and you look at some of this infrastructure culverts. I mean, we had a large boom in building between the 80s and 90s. Well, most of these pipes that we're finding and failing are CMP, metal pipes. Their life expectancy is 20, 30 years. And here we are, 2021. I mean, we're looking 30, 40 years. So
they're done.
Exactly.
How long do the new pipes last?
They're
like 50, right?
Yeah, the HDPE pipes, the high density polyethylene, they got about a 75-year lifespan.
Oh, wow.
Wow.
And these pipes we're lining a metal pipe with what they call an alpha line. It's a fiberglass sock basically that we pull through, inflate with air, and UV cure. There's also 75-year lifespan.
It's pretty cool.
Yeah, I know, and it is really
Yeah.
Yeah.
Mr. President.
Yes, Mr. Commissioner.
One thing that the board needs to keep focused on, these are the kinds of things that you have to have PAYGO for. You just have to have that cash flow available to use for these kinds of projects. So we need to focus on bundling as much as we can for debt projects as we possibly can. We talked about it last week and dealing with some things with the school board and stuff like that. But we've got to have money available for you when you need it right then and there to work these road projects. The next hurricane is next year, or this year, next August.
Correct.
So we don't know what it'll bring.
And that's true. I mean, the storm drain account we've utilized to help fund some emergencies, so we wouldn't have to come back and ask for additional fundings. I mean, we had a storm drain failure near Fox Run Boulevard. We used that storm drain account. We didn't plan to, but we were able to utilize this funding, to fix a storm drain that was failing. That summed up to about $300,000. you know.
Well, what was the presentation we had, just a couple weeks ago from the state? It was all about cut, right? You know, cutting grass, they cut that, some of the trash, you know, I mean, it's, yeah, it's unfortunate, and it costs you so much more money down the road to ignore it.
Yes, sir.
So, no, I'm with Commissioner Hutchins. I think you be proactive, and, you know, that way you don't have to clean up the mess.
The only other project that's really, you know, a large value would be our, of course, our MS4 account that we use for, you know, it's about $800,000 we're asking for. We utilize that in conjunction with the storm drain account, because we're fixing outfalls and, you know, eroded channels and so forth for the MS4 account, and then we'll use the storm drain account to basically rehabilitate the pipe.
But that's mandated, right?
MS4 is mandated.
That's what I thought.
Yeah, we report every year to the state how much we've repaired, you know, and how much credit we've got for treating additional runoff in a permitted area. So I believe that pretty much sums up our projects. I don't know if y'all have any additional
Any
questions.
other questions? Nope. Thank you, JR.
Thank you, JR.
Veronica, you have anything to add?
No, Commissioners. Thank you very much, and hopefully you won't see me again maybe till the end of March.
All right. Not that
Thank
that's a
you
bad
so
thing.
much.
Thank you, Veronica.
Thank you.
Thank you.
Thank you.
So the next item on the agenda is public comment. Do we have any public comment?
There are no speakers.
Thank you. So the next item on the agenda is commissioner reports. Commissioner Hart?
Okay. Not really a lot. Just, you know, an observation. You know, it's you know how much I hate regular TV, and I tell you, I'm so thankful, and you've heard me say it so many times when I walk through the county, and you talk to everyday folks, that yes, everybody knows that COVID is on us and everything like that, but folks are still, you know, polite and cordial. I still see such of the best out of people. So that gloom and doom out there is not a picture of us, you know, and I just want to thank the people of Calvert that, like everything else, it will pass. And, you know, best thing we can do is just stay being how we are. So
Thank you. Commissioner McConkey?
I just want to say, send my condolences to Anthony Williams' family. He did a lot in the community that a lot of people didn't even know that he did, because he didn't seek recognition for it. So it's going to be a huge loss for Calvert County. That's all I have.
Thank you. Mr. Hutchins?
Thank you, Mr. President. Sounding or seconding my colleague at the other end there with the COVID. Please continue to have patience. We're working as hard as we can across all sectors to try to deliver the vaccine into your arms, and literally. And so I think that, you know, it will pick up as we go forward. It's got to pick up, but it's going to take a while, even at the best rates, in order to get where we need to go. In the interim, you can do your part by continuing to, you know, practice the things that have been proven to limit the amount of spread of the disease, using masks, staying social distance, those kinds of things. Trying to keep our economy open is the absolute key. So if we do our part individually and collectively, we can help keep the economy open, and that's absolutely critical. Lastly, I mentioned in the opening of a public service announcement, Officer Brian Setnick will lie in state today in the rotunda of the U.S. Capitol, having been there for funeral viewings before of heads of state. That's an awesome experience to walk in and turn and salute a casket there. It sends a message, one I would never have dreamed of that we would be talking about, and that is an attack on our actual democracy right in the center of our government that resulted in the death of this officer and secondary deaths that also occurred from the incident. So let us try and pray to work together collectively as a nation, as a community, and change the dynamics of what took place there. Thank you.
Commissioner Weems?
Yes, sir, Mr. President. I want to give my condolences to the family and friends of Anthony Williams, as well as Sydney Sam Bowen. And on another note, I wanted to acknowledge Black History Month, and my birthday brother, Michael Kent, has written a book, or wrote a book last year, called Mulatto, The Black History of Calvert County. So I encourage all the citizens of Calvert County to look into that. And Commissioner Hart, magnanimous
I knew I was going to bring
word was, yes, related to me. But, you know, you spoke of the pandemic. There's a German word called Weltschmerz. And in essence, it denotes a deep sadness about the inadequacy or imperfection of the world. And, you know, try to shake that. Try to shake that. Try to be positive. Help others. And this will pass, this phenomenon. We've got a lot of, you know, requests, concerns about the vaccination. You know, it's very difficult. You know, I've been through many topics on a personal level as a commissioner throughout 10 years, but this one is difficult because, you know, the supply side is what we're waiting for. And I just ask for patience from the citizenry, and you know, don't back down. But I ask for patience, and that's all I have to report, sir.
Well, and you're right, Steve, and that's what, you know, and I hate, and I'm not downplaying it, but every time you turn on that TV, it's fear, 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 fear. This country is so much stronger than that. I mean, it's amazing how weak they think this country is at times. I mean, you look what this generation, what the generation before us did with World War II. I mean, and everybody knows that they don't need a history lesson in World War II. Our president had polio. Our president was in a wheelchair. You know, moms were in factories. Sports figures, actors all went out and fought for the country. This country is not that weak. You know, this is a problem, but it will pass. And that's why I get so infuriated with TV all the time with lead story, death, 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 death. Well, you know, a lot of good happened too. You know, and there's a lot of people working hard to minimize that and to try, you know, but it's a constant stir up of folks. And I'm glad that Calvert has not bought into that. I saw Montgomery County, one of their representatives on there the other day, screaming, 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 you know, we got 1.1 million people. Well, our folks are just as valuable. You know, and to me, they're more valuable because they're our folks. I mean, that's just my, you know, my view of that. But, you know, it's like, you know, like I say, it will pass. And we will still be here. So that's, yeah, America is, you know, from the time we hit this place, we've had to fight for our freedoms and our way of life. And, you know, we're not going to get taken out by COVID. So, you know, and mistreating everybody is not going to be the answer. So, but yep, so that's it.
So the only thing I want to add is I want to thank all the men and women that work so hard Sunday to keep the roads clear for the citizens, and also the first responders. You know, the first responders have a tough enough job, but then when you add in a snow component, and they won't stop because there's snow on the roads, they keep going. So I want to thank all those volunteers and our EMS providers out there that work through the storm. So that's all I have. So I think that concludes our meeting for today. You all have a great day. Oh,
Need a motion.
oh, I need a motion. Sorry. The chair would entertain a motion.
Yes, sir, Mr. President. I would like to make a motion to enter into closed session pursuant to General Provisions Article Section 3-305B3 to discuss property acquisition for a public purpose and directly related matters.
Second.
I have a motion and a second on the floor to go into executive session. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Now y'all can have a great day.